This report tutorial is to assist you as you interpret results with our dried urine test for comprehensive hormones for patients taking estrogens in their mouth, sublingually, under their tongue, or just somewhere where it's absorbed in the mouth, not intended to be swallowed. The issue with this type of route of administration is that inevitably most people are going to swallow some. And when you swallow it, you get a lot of first pass metabolism. What is that? That's a hormone that's going to go down into the gut, and essentially it's going to end up in the urine without having gotten into systemic circulation. And then another fraction of that is going to get into, if you will, systemic circulation, and then also find its way into the urine. You can't tell which is which, so you don't know how much is swallowed, but the amount that gets swallowed gives basically a disproportionate amount into the urine. So you can end up with these very high results, and it doesn't necessarily mean you're taking too much estrogen. It may just mean that you swallowed a great deal of it. So if patients are very careful, and go to extremes of collecting their saliva while they're administering the hormone, you can be fairly sure that you're not swallowing any, but under normal supplementation scenarios, people swallow them and they end up getting these types of results where there's just a pan elevation. They're all high. It's more common to get this sort of a result where E1, E2, and E3 are elevated, and then the metabolites downstream, they're not as subjected to the first pass metabolites. So when I see this type of a profile, I think the metabolites in aggregate reflect probably pretty well what's going on in systemic circulation. So the way to get good numbers on all these is either one, to go to great extremes to not swallow it, or two, you can skip it the day of the test. And when you skip it the day of the test, you're going to avoid the first pass, but the numbers you get are to some degree potentially an underestimation of what's going on the day of testing. So it's a limited scenario, but what we want to look at are, how much do we have of each of these estrogens? You're probably going to see a little bit higher estrone relative to the other compounds, because when you take estrogens orally, which you sort of are with sublingual hormones, you get a lot of estrone sulfate in the urine. Typically, that's going to bump those numbers up. But in this particular case, you're getting a lot of estrone sulfate. You get a decent amount of estradiol, so up in the upper end of the range. And then we can evaluate the metabolites. And that's probably the most valuable piece of this with sublingual hormones, is looking at how the metabolism pattern ends up. And you can see for this particular patient, the only metabolite that's elevated is the 4-hydroxyestrogen, and that could be somewhat problematic. Most people want to see the 2-hydroxy be preferred, and so we can look at that and evaluate that. The pie charts are helpful for that. In this patient, normally you get a 70, 10, and 20 sort of split with those three, and here you're closer to 80, 13, and 8. So there's an underproduction of the 16-hydroxyestrogens, a slight overproduction of the 4, and a significant overproduction also of the 2-hydroxyestrogen. So that's decent phase 1 metabolism, but you do have this high level of 4-hydroxyestrogens. How are you going to get rid of those? Methylation. And that's why we want to always look at methylation as well. So you'll want to evaluate that. We're not looking at necessarily, are the results low, are the results high? We're looking at the relative conversion. So for these two patients, their 2-hydroxy E1's about the same, but the 2-methoxy is very different. So there's a lot of methylation going on here as we look at the ratio between the two, and not very much going on here. So in those cases, you might want to look for genetic defects for methylation, most notably MTHFR, or you might want to look at potentially some of the cofactors that are involved in methylation. But you want to look carefully at the estrogen levels and the metabolites, but you just want to be really careful when you're looking at the absolute levels that you put it in the right context, especially if the patient has swallowed a high degree of the hormones, because that can be a little bit confusing, and you want to make sure that you put that in the proper context.